Now we're going. Okay. So this lecture recording here is the end of lecture of chapter 1. This is our second attempt. Sorry about that. Okay, I want to just go over these words because these words probably many of them seem very foreign to you right now. But I promise you, by the end of 231, these will be like, you can't believe you didn't know these once upon a time because you'll use them and they'll come up so many times. Nasal, obviously, oculus, eye, orbital eye, ocular eye. All of those words mean eye. Don't put, ocular drops in your ear. That's the point I made the other day. Your ear is referred to as the oris or the otic chamber. So you're going to put otic drops in your ear. Buccal. This is the buccal area. There's buccal muscles. There's buccal nerves. This is your the buccal area or your cheek. Cervicus refers to your neck. Now, there's a lot of things in our body that are referred to as cervical. There's a cervix of the uterus, but this is the cervical area. It has the cervical vertebrae in it. It has cervical nerves in it. It has cervical arteries in it. And like I said, those words we'll use them so many times. By the end of the term, they'll be second nature to you. But just so you know that right up front, the thorax is the chest. Okay. Surrounded by ribs, contains your lungs and heart. Mamma, or breast, or mammary. Why do you think we're called mammals? You ever think about that? We're called mammals because we have mammary glands, and we nourish our babies after they're born. That's what makes us mammals. So it's a pretty important thing from that point of view. Abdomen and umbilicus. Your belly button is your umbilicus. As far as your arms are concerned, I talked yesterday, this is your arm, this is your forearm, this is your leg, and this is your foreleg, right? No. This is your arm, this is your forearm, this is your thigh, and this is your leg down there at the bottom. So just keep that little point in mind. The front of the elbow is called the antecubital area. The antecubital vein is where most blood is drawn. The back of the arm, we've got another name for it. It's called the olecranon. That's the bone that you put when you put your elbows on the table. That they're sitting on your olecranon. Oops, I forgot to hook up my little clicker deal. Please advance slide. There we go. Thank you. I think I just jumped ahead a little more than I really wanted to there. Let's go back one. Nope, I guess not. Okay, coming down the front, lower in the lower extremity, your thigh, also called the femoral area. Femoral area has your femur in it. That's the biggest bone in your body is your femur here in your thigh. It also has a femoral artery, femoral nerve, femoral vein. They all run through that area. The groin is called the inguinal area. And then over here, the front of your knee is called your patellar area. Your kneecap or patella is there. The back of your knee is called the popliteal fossa. There's arteries and nerves and stuff that run through the popliteal area. There's also a bunch of popliteal ligaments. The crus is another word for the leg, crural. The ankle is referred to as the tarsus, T-A-R-S-U-S, tarsal area. The bones in your ankle are called the tarsal bones. The wrist is called your carpal area, and the bones in there are called your carpal bones. Both hands and feet have a bunch of phalanges. Phalanges are your finger bones and your toe bones. Your big toe is called your hallux, and your big thumb is called your pollex. So the pollex is really probably the most important extremity that we have. Men would doubt that sometimes, but nonetheless, it does all this fancy stuff. I don't know if you've ever really been as amazed by your body as you ought to be, but if you just look at your thumb and think what you can do with your thumb and what you can do because you have a thumb, and the fact that it moves in all directions, and it allows us to touch all of our fingers, and it allows us to pick up tiny little things and move them around, and it has great sensation. You can feel things really well with your fingers and your thumb. It's so critical, and probably is the most important thing that separates us Homo sapiens from lower members of the animal club. Yes, it works. Okay. A few more regional areas. The acromion. This is the acromion right here. The acromion is a bulge on your scapula, which we'll get to when we get to bones here soon. The dorsal side of your dorsum is the back side of you. The front side is the ventral surface. Any fishermen in the crowd? Anybody ever catch a salmon? Everybody ever catch a salmon that had a fin missing that was cut off at the fish hatchery? What do they call that fin? The dorsal fin. That's right. At the fish hatchery, they cut off the dorsal fin, which is one of the back on the top, and that tells you that it was a hatchery fish, and therefore, if you catch it, you can keep it. If it does have a dorsal fin, that means it was native born in the river or in the stream or creek, and you can't keep it. You're supposed to put those back. Dorsal. Olecranon I mentioned already, and so forth. Here's the popliteal area, the popliteus. There's muscles named that, and so forth. The cap is called the sural area. There's a sural nerve. There's just the sural area. The heel is called the calcaneus, and that's the bony thing that you stand on when you stand on your heel. It also is what attaches the calcaneal tendon, which attaches the two big muscles that come run down the back of your calf here. They're attached by your Achilles tendon or your calcaneal tendon. Calcaneal tendon. Butt, gluteus, so forth. A lot of stuff in your book. You can use this to review by, or you can use the pictures. As far as the belly is concerned, we usually divide it into 4. In my practice, I know we never used anything more than this: right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. However, in the book, it describes the tic-tac-toe board on the belly, which divides it into 9 areas. Umbilical is around the belly button. Below that is called the hypogastric or the pubic region. Above it's called the epigastric region. The right and left hypochondriac regions are named because they're underneath this big cartilage here, the cartilages that attach all your ribs here, the hypochondriac region. Lumbar areas are out to the side, right and inguinal areas down here, your groins on either side. So you can see what organs are in each group, but let me tell you, in the abdomen, everything tends to move around to a certain extent. The appendix most usually is in the right lower quadrant and down in this area, but it can be way down here, and it can be way up there, and it can be way out there. So all of these different organs in the abdomen are a little bit hard to figure. The gallbladder is almost always in the right upper quadrant. Spleen is almost always in the left upper quadrant. Yeah?
Before we move forward too much, so I have the 10th edition, and so on the man with all the anatomical parts, I don't have the same terms. You know.
Why don't you show me that in lab?
Different. Okay, sorry, yeah.
Yeah. Just know the ones I talk about. You know, Kyle made a point. I do make a 100% effort to never ask you something that I didn't talk about. I either talked about it in the lecture or I talked about it in the lab, so you can assume if I don't talk about something at all, probably don't need to know it.
So, like, with the upper and the lower quadrant, can you say that, like, it's separated by, like, where the diaphragm lays?
No, the diaphragm is way high. The diaphragm's way up here. Okay. So when you're dividing the right lower quadrant, left quadrant, you're making an X through the belly button, through the umbilicus.
Okay.
Anatomical terminology here. The front is called the ventral surface. Back is called the dorsal surface. Where'd those names go? I don't know. All right, anything up towards the head is called cephalic. Okay, so the arm is cephalic to the leg. The chest is cephalic to the abdomen. Okay, it's closer to the head. Caudal means posterior, so the buttocks is caudal to the shoulders. So caudal is closer to that end. C-A-U-D-A-L. Caudal. In addition to calling the front side ventral, you can also call it anterior, okay? Because remember we talked, I think, about anatomic position, and when you're in anatomic position when you're standing with your palms facing forward, like you see this lady here, that's anatomic position. A couple more terms, medial and lateral. If something's medial to something else, it means it's closer to the midline. This is the midline, obviously. If it's farther out, it's lateral. Proximal and distal, proximal and distal are terms that are pretty much only used on the arm and on the leg. If it's proximal, it's closer to the body. If it's distal, it's farther out there. So the toes are distal to the knee. The fingers are distal to the shoulder. Right and left. That's up there too. Also superior and inferior, two other terms that are often used. And we'll use all of these. And we use them kind of interchangeably. There's nothing magic about those. So I'll just, there's another graph that's in the book. I don't try to go over things that are that. Were the prints that small, I can't read them with my old eyes. All right, let's talk about anatomical planes and anatomical sections, because if you ever had geometry, you probably remember that 1 point is a point, 2 points makes a line, and 3 points makes a plane, right? Remember that? So that's what we're talking about. We're not talking about an airplane, we're talking about a plane, okay? So plane is a three-dimensional axis, and sections then are slices parallel to that, and all of these things help us understand anatomy. These things are all, these planes and so forth are really important in MRIs, CAT scans, PET scans, all of this stuff, because what they do is they electronically create slices of the body. So a CAT scan can go from the top of your head to the bottom of your foot, and they'll put you every 2 millimeters, they'll take a slice of you and create a picture of that transverse slice. So in our, from what we need to know here, you need to know that a frontal plane, and frontal is one of the more common views that you're going to see, a frontal plane is a plane that goes in this plane right here. Now it can be very forward, it can be very backwards, but it's going in this direction. Another name for the frontal plane, by the way, especially up here in the head, we call frontal planes in the head, we call those coronal planes. And that comes from the crown, the king's crown, the big flat thing up here on top, I guess. This is the frontal plane, and the coronal plane. We only use coronal though, referring in the head. Transverse planes are obviously transverse across the body. So a transverse plane down in the body might look like this, where you see the body in the middle and both hands or both arms down here. And then there's the sagittal plane. The sagittal plane is one of the most important from anatomy. We're going to take when we're in 232 right now, we're dissecting sheep brains, and we cut them right down the middle. That's the sagittal plane. So then you look at the two sides of the brain, which are the same, just backwards, and you got a right and a left half. So the sagittal plane divides everything into a right and a left half. Now there's parasagittal planes, which run just parallel to that and just coming across, but in the same direction. Let's talk about body cavities, and I want you to pay attention to this because I really would like you to understand the body cavities after we do the rat dissection. In fact, I think that's one of the main things we want to learn in the rat dissection is the body cavities. Body cavities are, there's a number of them, and we're going to learn them. And they have several functions. Mostly, they function to prevent the organs from being hurt. So if somebody punches you in the belly, your intestines can kind of move away because they're kind of floating around in this cavity. Now, that cavity you might think has a lot of water in it. No, it really doesn't. In fact, most of the time when we would open up an abdomen and look around, we might find 5 cc's of fluid. Just a few, quarter of a handful. I mean, there's just hardly any fluid in the abdomen normally. Now, if somebody has a bad infection in their tummy, they might have 2 liters of fluid, but most of the time there's very little. Just enough to kind of keep it wet and allow the guts and things to roll over each other. Let's start by naming the cavities. The dorsal body cavity is this one back here that holds your brain and your spinal cord. Obviously, it's on the dorsal side of your body. Dorsal cavity only holds 2 things, the brain and the spinal cord. The ventral body cavity, or often called the coelom, I don't use that word, I don't know where it came from, but anyway, it's divided up into several parts. We'll go through that here. So starting of all, the dorsal cavity is the yellow one here, involves the brain and the spinal cord, and that's it. Okay. It's floating in water. It's got layers around it called the meninges. We'll get into that later. The ventral cavity, which is on the ventral side of the body, obviously, is divided into 2 major parts. The first part is called the chest cavity, or the thoracic cavity. Then there's a diaphragm here, which is a muscle that divides things, and you'll see that very clearly on your rats. And everything below that is called the abdominopelvic cavity. Now, this picture is wrong, okay? I'll just tell you, this picture is wrong, because there is no such structure as this right here. There is nothing that divides the abdominal cavity from the pelvic cavity. All it is an imaginary line going from the top of your sacrum right here, across here to the inside of the top of your pubis. So what is found below that is called in the pelvis. That would involve normally the uterus, the ovaries, the bladder, the end of the ureters. They all live down here in the pelvis. The colon does too. The sigmoid colon has to make its exit out through the backside over here, so it cuts through the pelvis as well. The abdomen is everything else and involves all the other organs in the abdomen. So this is better called the abdominopelvic cavity, and just know that this is an imaginary line only that separates the pelvis from the rest of the abdominopelvic cavity. So this is a diagrammatic representation of this because it gets a little more complicated than what we've talked about so far. Let's just start over here with the one we've talked about a little bit. The ventral body cavity, which is the total thing here, is separated by the diaphragm into the abdominopelvic cavity and the thoracic cavity. The abdominal cavity contains most of the digestive organs. The pelvic cavity these aren't really separate, but contains the bladder, reproductive organs, and the last portion of the digestive tract. The cavity that is in the abdomen is called the peritoneal cavity. Peritoneal, that's a really important word. You've probably heard somebody has peritonitis, okay? If they have an infection in their abdomen, they get peritonitis. Peritonitis is an infection in the abdomen. Okay, the thoracic cavity on top up here is the one that's divided into several others. Thoracic cavity has 2 pleural cavities. There's a pleural cavity on the left side and a pleural cavity on the right side, and the pleural cavities contain the lung. So the right lung is in the right pleural cavity, the left lung is in the left pleural cavity. Okay? Between those 2 pleural cavities, here, out here, In between that is called the mediastinum, the middle of the chest, okay? And the mediastinum has several things that run through it. The trachea, which you breathe through, your breathing pipe. The esophagus, which carries food from your mouth to your stomach, that runs through the mediastinum. And a bunch of major blood vessels like your aorta and your vena cava, and we'll talk about those later. But it also, in the mediastinum here, in this part in the middle, on the front half of that is what's called the pericardial cavity. So the pericardial cavity lives here between the two thoracic cavities, and it contains the heart, okay? So your heart's in there, and it's beating away all the time right now for every one of you. And it lives in this little cavity, this sac, this pericardial sac, which has a few drops of fluid in it, and that allows it to slide around in there and move without hurting you. And people that, for one reason or another, their pericardial cavity dries up, and they don't have enough fluid in there, then it hurts. Every time their heart beats, ow, ooh, ah, ah, as you can imagine, and we call that pericarditis. Okay? So you're going to find out in A&P that all of these words hook together pretty well. Once you learn the basic ones, then everything builds from there. For example, we have a condition called mediastinitis of people who get an infection in the mediastinum in here. If they have a hole in their esophagus, leaks some juice, some spit out into their chest here, that gives a rip-roaring infection called mediastinitis. If you get an infection in one of your pleural cavities, what do you think you might call that? Pleuritis, right? Now, there's another. So if you have pleuritis, for example, and every time you take a deep breath, it rubs. Okay, the lung rubs on the chest wall instead of just sliding by. It hurts, and that's called pleurisy. Okay, you may have heard that word before. Pleurisy. Old grandma had pleurisy. She got it from TB. Well, what that means is every time grandma takes a deep breath, her pleura that's on the lung rubs up against the pleura that's on the chest wall, and ow, ooh, it hurts. And people who have pleurisy don't want to ever take a deep breath. And the other thing about pleurisy is you can actually listen with your stethoscope over an area where you have pleurisy, and you can also hear, you will often hear what's called a pleural friction rub, where you can actually hear the lung rubbing against the pleura. And patients going, ow, ow, ow. It always hurts. Okay. The body cavities, all of these cavities that we just talked about, are lined by serous membrane. What does serous mean? Serous means it's mostly serum, okay? So it's not mucus. Mucus is really thick, kind of snotty stuff, right? Serum is just kind of clear liquid that's not sticky and it's not full of mucus. So serous membranes, and the serous membranes, there's two layers. One layer is around, for example, we use the lung as an example. One layer of the membrane is on the lung itself. It's the actual outer layer of the lung. And we call that the visceral layer. In other words, that layer is actually on the viscera. Viscera means guts or organs. Okay? So the visceral layer is the layer that's on the lung itself. And then there's the parietal layer, which is on the ribs, on the inside of the ribs, to make the other layer. And those two layers are the ones that rub up against each other. And usually they're slippery and they slide easily and it's no problem. All right, well, you guys are going to need to understand the difference between the parietal layer of all of these different cavities and the visceral layer of all of these different cavities. And it's really simple. If you just remember, visceral layer is on the viscera. It's on the organ. And the parietal layer is the outer layer of the cavity. I think I've said all of this. think this diagram right here is one of the most important diagrams in A&P. Wow. It's so simple. It's a guy with a fist pushing his fist into a balloon, okay? Well, think of the balloon there is the way all of these cavities form, okay? So you have a layer, a couple of layers of this serous membrane, and the organ grows down into it. So that one layer, this layer here, is going to become the visceral pericardium, right? This layer here is going to become the visceral pericardium. And this layer here, which forms the outside of the cavity, is going to be the parietal pericardium, okay? Now, you can say the same thing about the abdomen. So there's going to be a visceral peritoneum, peritoneal cavity, peritoneum. Visceral peritoneum is on all the organs. And then the parietal peritoneum is the inner lining of the cavity. Like when you open up the abdomen, it's the edge, it's the wall. You notice here on this picture, there really is no difference between the pelvic and abdominal cavity. That's the way it works. Here's an example of the cross slice, a transverse section through the chest, and you notice that there's the peritoneal cavity up here in front, which has the heart in it, and notice that it has a visceral pericardium and a parietal pericardium. These are the two pleura here and here, and so this is the pleural cavity. But remember, the pleural cavity really doesn't have any space to it at all. It's only got a few drops of fluid in it. And it's got the visceral layer, which is the side that's on the lung itself, and it's got the parietal layer out here, which is on the inside of the ribs. And when you look at your rats today, that's going to become really obvious to you. This is the mediastinum. I told you that the mediastinum is what's between the right and left lung, and it contains a bunch of stuff. It doesn't have it drawn in here, but obviously the trachea runs down through there, the esophagus runs down there, the aorta, and so forth in the mediastinum. And then on either side of the mediastinum is the right and left pleura, and in front of most of the mediastinum is the pericardial cavity. I think I beat this to death. I hope you understand it. If not, I want to show it to you in lab very well today. Peritoneal cavity is the abdomen. When you make an incision in somebody's belly and you're going to operate in their abdomen, you go through the skin, you go through the fat, you go through the fascia, which is the tough muscular coverings, and then the last thing you open is the peritoneum. And that's the abdominal cavity itself, and that gets you in. So the parietal peritoneum lines the internal body wall, and the visceral peritoneum covers the organs. Now, don't get confused by this, because when you look at a piece of intestine, you're not going to see a special layer on the outside of it, because that visceral peritoneum has actually just become part of the wall of the intestines. The wall of all these things. You can't usually peel it off. Abdominal cavity is the top part, the pelvis is the bottom. The retroperitoneal space, this is a word you need to understand. What do you think retroperitoneal means? Behind the peritoneum, okay? And you need to know what organs live behind the peritoneum in what we call the retroperitoneal space. And here they are. The pancreas. The pancreas is right up against your backbone. That's why people who get pancreatitis mainly get pain in their back. People who get pancreatic cancer mainly get pain in their back. The kidneys are in your lower back here, but they are behind the belly. The ureters, which take the urine out of the kidneys and run it down to your bladder, they run retroperitoneally. They don't run out through the peritoneal cavity. Parts of the digestive tract. Well, that's kind of cheesy. What that means is the second and third portion of the duodenum, write this down. The second and third portion of the duodenum, which is the first part of the small intestine, are retroperitoneal, and also the rectum. As the colon comes down and it turns into the rectum and it's ready to go down to the anus and leave the body, it goes retroperitoneally. So the last 10 centimeters or so of your colon are actually retroperitoneal.
How much, what's the length again?
10 centimeters. Not that far. Okay, pelvic cavity, I spelled this out for you because I don't like the way the book handles it with that wrong picture. There is no separation between the abdomen and the pelvis. It's just simply an imaginary line. Come on, baby. That's the last slide. No wonder it won't advance. Okay. I'm going to stop it then.